tend to have some emotional trauma.
Call in to get free consultation on children's health on 07000 917 917 or 090 256 25455. You can send in questions, cases, and related contributions on social media, Facebook, Twitter, and Instagram at WFM917. Text and WhatsApp on 070 317 56537. You can listen live online at www.wfm917.com. Radio Doctor, Nigeria's first free consultation radio health program on WFM 91.7, the voice of women.
Top of the morning to you. Time check. It is 12 minutes after 10 this fine Monday morning. Today, the 8th, I said the 12th, the 8th of December 2025. You're tuned into Women Radio 91.7 FM, the voice of women, Nigeria's first and only radio station for women and their families. And this is Radio Doctor. Radio Doctor is Nigeria's first specialized radio health program where medical doctors consult and advise on radio on your Women Radio 91.7 FM. My name is Fumi Bangwala, and our radio doctor today is Dr. Olufunmilola Akinyola, a consultant pediatrician at St. Ives Family Hospital. Good morning, Dr. Akinyola. Long time no see, long time no hear.
Good morning, Fumi. Nice to join you once again.
Yes.
This morning. Happy new month and compliment of the season to you.
Yes. Same to you. Hope you're good.
Yes.
What are your plans for Christmas? Do you have plans for Christmas? That's what we're talking about this morning. You can watch us live on YouTube at WFM 917, and you can listen to us on the go via our website www.wfm917.com. And then you can call in 07000 917 917 or 9155 917 917 to also call in to join in on the conversation. All right, let's get into it. Dr. Fumilola, when we say a toddler has recurrent cough and catarrh, medically, what does that actually mean? Hello, Dr. Fumilola.
Hello.
Yes,
okay.
You're here now. Okay. The question is,
again,
okay, when we say a toddler has recurrent cough and catarrh, medically, what does that actually mean?
When you say that a person have a recurrent cough and catarrh, this is a persistent issue, or say it's a chronic situation in which there is persistent cough with excess mucus, which he describes as catarrh, causing a nagging cough, often due to inflammation from infection such as cold, flu, sinus issue, and allergy related issue. So it's when you have a persistent chronic cough and excess mucus production from the respiratory tract, the nose, and usually lasts, which has lasted for up to 4 weeks in a toddler or children, and lasting for up to 8 weeks in an adult. And it's usually related to infection such as viruses infection, bacterial infection, maybe due to uh, postnasal drips from sinus issues, and may also be related to allergic cause such as hay fever.
Okay. All right. The next question is, why does this problem seem very common among toddlers, especially in Nigeria? I know there's the case of what they call them infection at school. You know, when they go to school, that happens. But why is it so common among toddlers, especially in Nigeria?
It's really common in toddlers because the immune systems of the toddlers is just developing, and so some of these um, factors that cause this, such as viruses and bacteria, they are easily transferred, you know, to this age group, the toddlers, because their immune system is still developing, is not fully developed. And at the same time, you realize that because their immune system not fully developed, they easily transfer it from one person to another, especially toddlers that goes to crèche, you know, where you have a lot of them coming together, either in crèche or in preschool. In this age group, we have most of this age group going to preschool or crèche. So easily this virus, if it infects one of them, easily they transfer it from one person to another, because their immune system is not fully developed, and also you know, then they easily get some of these infections that are caused by viruses and
Okay, we have
bacteria.
sorry to interrupt, we have a call this morning. Hello, good morning. Oh dear, the person has has gone off. The number to call once again, 0800, that's the toll-free line, 0800 123 5917. That's if you don't have credits, 0800 123 5917. For other calls, 07000 917 or 081 09155 917 917. Okay, let's go on. All right, Dr. Akiana, can you tell us how the immune system of a toddler, how does it work, and why you had mentioned that is because, you know, their immune system has not fully developed, but can you explain how their immune system works and how it is different from that?
The immune system of a toddler works through two main parts: the innate system, which you describe, which is rapid, but built in defenses like skin mucus and acquired system, and learn to fight specific organism or germs using memory cells and the antibodies it has produced toward that germs. So it develops over time, just as I mentioned earlier, and they as they encounter infection, and such as breast and through breast milk, and they also develop by exposure to vaccine. So though it's still maturing and generally become more stable by the time they are age 3. So, and this ongoing learning process, it's combined with maternal antibodies from the mother, and through breastfeeding, they build their unique immune system. So it works through two parts, just as I mentioned. First, through the maternal antibody that they
Okay.
get from the mother, and also through breast milk, the immune system I mean, they are exposed to enzymes or hormones that help them to build their immune system. Then the other way is through the vaccines. You know, by the time they exposed to vaccines, it
Mhm.
also helps them to build up their immune system against a specific organism. And by the time they are also exposed to this organism, they also develop antibodies toward this organism. And this is a gradual process which fully matured by the time that they are aged 3 years.
Okay. All right. Thank you so much, ma'am. So, what are the most common causes of repeated cough and catarrh in toddlers? Are there environmental factors that make it worse? What are these causes?
Yes, the most common causes of cough and catarrh in toddlers uh, can be, I mean, include environmental factors, and
Mhm.
also can be caused by um, infections such as cold, flu, um, sinusitis,
Mhm.
or other respiratory um, infections, which can be from uh, viral causes or by bacterial causes. Then it can also be due to allergies, you know, reaction to protein,
Okay.
pollen dust and pollen danders or mold are due to allergies. Uh, and it's also one of the commonest cause of cough, and catarrh.
Okay.
Then other causes include non-allergic rhinitis, which can be from the environmental, like irritation from exposure to smoke, you know,
Okay.
um, environmental pollution, strong smell, or weather changes. And it can also be due to secondary smoking. If
Okay.
parents, if one of the parents is smoking,
Mm-hmm.
then can be also be due to asthma, you know,
Mm.
especially cough. If cough variants asthma, where coughing is the main symptoms, it can be one of the causes. And once when you also have postnasal drip,
Okay.
and this is the primary link between the cough and catarrh. Mucus from the nose and sinuses drips down into the throat to cause cough.
Okay, but what about environmental factors like cold weather, dry weather? Like for instance, now we're in dry weather, but I've been seeing quite a few kids have catarrh with their nose. Do they also play a huge factor in causing catarrh for kids?
Yes, I mentioned it.
Okay.
I said non-allergic
Oh,
rhinitis.
that's non-allergic. Okay.
All these ones are put under they are the environmental causes. And
Right.
they cause irritation of the respiratory tracts, the nose and the respiratory tracts,
Mm-hmm.
causing uh, with their strong smoke, with the strong smell, it causes irritation. And we
Okay.
can have weather changes, either hot weather or cold weather can also be responsible.
Alright. Okay. All right. Now, for parents, how do we know the difference between a normal viral infection and something that might require urgent medical attention?
Most of the time, a parent may not be able to know if the cough or catarrh
Okay.
that the children have is due to maybe it's just normal from cold or flu. Even if you have cold or flu, cold of I mean normal cold, there is nothing that is normal.
Mm-hmm.
Cold can never be caused by viruses which are caused by influenza virus,
Okay.
or it can be caused, by allergies. So there's nothing that's really normal.
Okay.
But when you have associated temperature changes like fever, most viral causes are associated with fever. When you have the patient having cough, catarrh, then they have fever and other symptoms. But if it's due to allergies, the patient may not have fever. It is not associated with fever.
Okay. Okay.
And
Okay.
there is usually history of allergy, background history of allergy in the family, or
Family.
when it is due to allergies.
Okay. Okay. All right, ma'am. Now, what conditions? Okay, no, we mentioned that already. When should a parent begin to suspect asthma or allergic rhinitis, like you mentioned, as the underlying issue? Is it when the child is unable to breathe, or when should that parent begin to suspect?
When it comes to cold and when it comes to cough and catarrh that is due to allergies,
Uh-huh.
there there are various spectrum of it.
Okay.
Some of them that will just have cold and catarrh, which is limited to that, may not affect other parts of the body. But that still doesn't totally rule out allergies. For what I mentioned earlier, when it comes to allergies, you realize that this symptom is recurrent and you have history of same symptoms, probably in the other members of the family, and they are not associated with signs of inflammation, such as fever.
Okay.
When it comes to allergies, asthma too is an allergic symptoms,
Yeah.
but you also realize that there is associated shortness of breath when it comes to asthma.
Mm-hmm.
They may also have same symptom of cough, catarrh, but usually associated with fast breathing or chest pain. For an older children that is able to express himself, may also say that they are having chest pain. But the symptom of asthma is cough, fast breathing, or chest pain. So it's not limited to only cough and catarrh. But
Okay.
yet you can have allergy, and that is limited to only cough and catarrh. That's why I said that they are spectrum. There are some of them that shows their allergic symptom also by having skin rash
Okay.
in associated with the cold and catarrh. They will have skin rash. It's also part of the spectrum of the allergic symptoms.
Okay.
While some of them may have it allergic conjunctivitis, in which the conjunctivitis, in which the eye is also involved in the allergic reaction.
Mm-hmm.
They will have eye itching, and the eye may also be red.
Okay. All right. But now I want to sort of digress into something. When teething, I want to talk about teething. When babies are teething, they typically say that, oh, teething is what is causing the cough or the catarrh. Is that a myth or is it actually true?
I would say it's a myth.
Okay.
It's not really true.
Okay.
What you realize is that at the age of 6 months, when teething usually started or common in children,
Mm-hmm.
it is also at this age that they are more exposed to their environment, where they explore their environment, where they pick things on the floor and put into their mouth.
Mm-hmm.
Teething can be very, very stressful, but your child does not necessarily have to go through diarrhea, run fever before teething.
Okay.
You may when a child that is well taken care of, a child that is well prepared for teaching may just open his or her mouth
Mouth.
on, I mean, at that period, and you
Mm-hmm.
notice that this child has erupted a teeth without any drama. But because during this period is the time that they explore their environment,
Mm-hmm.
it's also during this period that the immunity that they get from their mother went down.
Yeah.
So they are slow at the lower nada of their immunity. So it's also during this period they explore their environment that is well fed and is well prepared, you know, for teaching. They just smile at you one day and you notice that
Yeah.
this child has erupted his or her own teeth without going through all those drama.
Okay. All right. Thank you so much. Now, what signs should a parent experience with their child to know that, I cannot continue home remedy. Let me take my child to the hospital.
When a child is having cough and catarrh, because we are dealing with cough and catarrh in toddlers for today topic, I mentioned that cough and catarrh can be caused by infective
Mm-hmm.
causes and can also be due to allergies mostly. And when you have associated fever and the child is running temperature, still having this cough and catarrh with fever, and which is persisting, lasting for more than 1 or 2 days, and you have given paracetamol to put down fever and it's not going, then be sure that this is not just a cough and catarrh you take with levities. Please take this child to go and see your doctor.
Okay.
And the other way, if it's due to allergies, and there are some other symptoms that are associated, just like fast breathing,
Mm-hmm.
with persistent cough, with fast breathing, or you see other sign like skin rash or eye itching, then take this your child to see his or her doctor. It may be due to allergies, and when your doctor take full history and examination, you'll be able to distinguish which one of these is caused by infection or which is caused by allergies.
Okay. What kind of test or evaluation, just to speak, continue from that conversation or that answer, what tests will be done for the child typically at the hospital to be able to know what exactly is wrong with the child?
Most of the time, by the time a doctor that know what he or she is doing, get in contact with his or her patient that cough and catarrh, recurrent cough and catarrh. From taking enough history and examination is enough. If it's just mainly cough and catarrh, it's enough to make a what do I call it? To make a
An
diagnosis
evaluation diagnosis. Okay.
of what is happening with this child. But in case this child is now having fever alongside with the cough and catarrh as the primary symptoms, then in order to be able to know, then the doctor that this is an infective cause. Most of the infective cause of cough and catarrh is usually due to viruses.
Okay.
So, but just to be sure that it's not a bacterial infection, your doctor may request for full blood counts, but not in all cases, especially when the child is not running fever. It may be due to allergies. But just to distinguish if it's due to bacteria or due to virus, the child may need to do a full blood count.
Okay.
That's one of the simple tests to be done to evaluate or to make diagnosis. But if it's due to other thing, we need to do further examination or further investigation.
Okay. Now, for home remedies, I want to ask this question in two ways. The first way is when a child is coughing so bad and using coughing so bad and is having catarrh so bad, what home remedies can they use to help soothe the cough? On the other hand of home remedy, we see a lot of parents use cough syrups or antibiotics for the child. Which one? And then, of course, once you start using antibiotics, even for cough that is not serious, then we will have that. That's how you not insisting that the child becomes resistant to the antibiotics. So that's for home remedy. Which practical home remedy should they go with? And then what do you say about the other part of home remedy using cough syrup and antibiotics that they already have in their first aid boxes at home?
Using antibiotics is not an home remedy
Okay.
for the treatment of cough and catarrh in toddlers. I mentioned earlier that cough and catarrh in toddlers can be due to two main causes, either allergies or infective. For allergic causes, you don't need antibiotics.
Okay.
And even if it's just ordinary cough and catarrh, if I'm allowed to use that word, or if it's not due to allergies, the most cause of cough and catarrh in children is viruses. And for virus, you don't even need antibiotics. Most of the time, it's run its course and it goes with time.
Okay.
So I will advise parents not to use antibiotics. So in order to soothe cause, the throat and cough, I will advise parents to give the children plenty of fluids, and if possible, let this fluid be warm.
Okay.
They can take the juice, the fluid in form of water, warm water. They can take herbal teas, like peppermint tea or broth, chicken broth,
Okay.
you know, it helps to thin the mucus and helps to expel the mucus. Honey is also good, but it is not advisable to give honey to children that is less than 2 years old. You can put honey in water, or spoonful of honey. It helps to soothe the throat. It also suppress cough. But don't give to children under 1 year, under 2 years old. Maybe older children, honey will be helpful. Um, for the excessive mucus, when you're having cough and catarrh, you can, and also to prevent, to reduce the postnasal drips that irritate the throat to cause cough. You can use salt water gargle.
Okay.
Dissolve half teaspoon of salt in warm water to reduce inflammation and to soothe scratchiness.
Okay.
Then lemon juice is also useful.
Mm-hmm.
Mix honey and warm water to be able to get mix with honey. Mix lemon juice with honey and warm water. It give vitamin C and also it's have an anti-inflammatory benefit. Then in order to clear catarrh and congestion, you can use steam inhalation
Yeah.
in which uh, let the child inhale steam from a hot shower or a bowl of hot water with
Mm-hmm.
towel over the head to loosen the mucus. Then use of humidifier at home is also helpful. It adds moisture to the air to help to clear the nasal passage. Then elevate the head. Always sleep with extra pillow when you're having congestion, and it helps drainage, the drainage of mucus. And if possible, if you have what you call a nasal potty, then you use salt water inside the nasal potty, put it into the nose to rinse the nose
Okay.
to reduce the mucus, excessive mucus. These are the home remedies that can be practiced at home.
All right. What about lifestyle changes? Cleaning routine, air quality, sleeping habits. I know that a lot of houses in Nigeria have poor ventilation, but in how can families create better ventilation? Because if the air is thick and the air is just circulating, then that also will cause cough and catarrh. But how important is this? What else can they do to increase air in the house and reduce the frequency of infections?
Um, Poor ventilation is not ventilation by per se
Okay.
that cause uh, cough and catarrh. There are two things when there is poor ventilation. When there is poor ventilation, the causative organism especially viruses that cause and catarrh can be easily transmitted from one person to another. That is the relationship between poor ventilation and cough and catarrh.
Mhm.
And also, when there is poor ventilation, there is possibility for the growth of mold, dust, I mean, settle in the house,
Mhm.
pollen, I mean, house dust mites, you see around growing and thriving in an area where there is poor ventilation. So, and these are the cause of the allergic cause of and cough and catarrh. So those are the two things that happen when there is poor ventilation. So it's not that because poor ventilation directly then you will have cough and catarrh. So it is due to it helps in transmission of the viral cause, and also it helps in the growth of the allergic risk factor. So if there is poor ventilation, there is increase in also, it helps to prolong the environmental pollution that is related to allergic cause of cough and catarrh. So the house should be should be well ventilated to be able to reduce this risk, and also avoid house that is dusty, that is moldy, especially for those that have allergy or have history of allergy in their family. All this one will reduce the risk of the causative agents of cause and catarrh, either virus, bacteria, or allergies.
Okay. All right. Thank you so much, Dr. Akinola. Today was quite informative, even for myself who thought a particular way with regards to cough and catarrh. Now I'm learning, like, hey, first of all, it's not all cough and catarrh that you treat with levity. Second of all, some cough and catarrh are serious and you need to take them to the hospital. Also, less dependence on cough syrups and antibiotics. Thank you so much, Dr. Akinola, for coming on the show today. It's such a pleasure to have you back on the show this morning.
Thank you for having me.
Yes. Radio Doctor on Women Radio WFM is Nigeria's first free consultation specialized radio health program, broadcast Mondays through Fridays at 10 a.m. to 11 a.m. Do join us tomorrow at 10 a.m. for another edition of Radio Doctor. Thank you so much, Dr. Akinola, for coming on the show today. We truly appreciate you.
Thank you for having me once again.
All right, do not go anywhere. We still have amazing shows on Women Radio 91.7 FM. Don't touch that dial. My name is